At this point, we are in an unprecedented time of rapid evolution in the industry. We have the whole transition from volume-based payment to value-based payment, and we've had in the past changes in payment structure occur. 1983 with DRGs, 1998 with the Balanced Budget Act. But this time there are fundamental structural changes that are occurring as well, and forces outside of payment reform that are occurring. So you have disruptors such as decreasing inpatient use rates. So the underlying volume of inpatient need or the utilization of inpatient facilities is dropping across the country in virtually all markets and for all types of providers. You also have a deceleration in the growth in outpatient volume, procedural volume specifically. So that changes quite a bit of the dynamic in the marketplace. You also have outside disruptors. You have organizations and companies who are not even providers or haven't been providers who are entering into the healthcare market and using their expertise specifically in retail and in their ability to communicate and connect with patients directly with information and web-based tools and the like to make access to care less expensive, maintain the quality, and really build on the concept of the user, the consumer, driving the decision to acquire healthcare or health as opposed to being driven by the doctors and the hospitals. Because of all of these pieces, it's incumbent on the financial leaders of the organization to really take the forefront and help their management teams, help their boards truly understand the potential positive and negative of the future. There are a lot of organizations where they'll say, the management teams will say, things are so dynamic, things are changing so quickly, how can we plan? Why is this a good time to plan when we don't know what the assumptions are? And the reality is it's the most important time to plan. And it's the most important time to really start to understand and quantify the potential implications. You're not going to get it 100% right. You're going to get orders of magnitude and directionally correct. But that can enable a management team to establish a whole series of proactive strategies, internal and external, to deal with these changes in the industry. The thing that we see a lot is that with all of these changes in the marketplace, a lot of attention is being paid to doing one-off type of analytics and innovative analytics that may or may not get to the core issues. We believe that it's vital that you go back to the basics. And so if you take the first tenet of financial planning, which is that the cash flow that you generate has to be sufficient to meet all of your strategic and basic needs within a credit context. If you use that as your basic premise, then everything else drives from there. So understanding the current credit position of your organization, understanding your capital position, understanding the potential level of needs that will be required to pursue a variety of strategies, whether they're simply internal cost management types of strategies or pushing to try and be a population health manager. I mean, the whole continuum. The key is that you need to understand at a baseline, where do your operations go over the next several years, given the changes we know about and given the changes we anticipate, and then begin to layer the strategies on top of that to address some of those changes, but also to address the knowns, the reductions in GME payments, the reductions in disproportionate share payments, the lower increases in reimbursement, et cetera, et cetera, et cetera, potential impact of exchanges. all of those things we can quantify, and we need to quantify, so then we know what the gap is that we have to fill through our various strategies to be developed. It's not a question of developing new skills. The skills are there. I mean, really, it's corporate finance skills, it's deep, solid analytical skills. The piece that has to happen, that doesn't happen uniformly throughout the industry, is for finance people to move beyond the Office of Finance. And so we have all of these strategies that are being played out, all these initiatives that are being discussed, time and energy being put into them. It's vital that the finance team be at the table in those discussions, understanding the strategies, pushing back on the strategies, trying to get definition and refinement of the strategies to the point where they can be quantified, or their potential impacts can be quantified. It's not enough to say we're going to pursue strategy X because we saw it in a magazine somewhere. The question is that appropriate for your organization? And quantitatively, what does that mean in terms of different aspects, but ultimately financial implications and sustainability and long-term ability for the organization to thrive? So for the finance folks, it's about going beyond the financial numbers and being part of the team that is developing the strategies and the initiatives, so that when they're brought forward, you're bringing forward the strategy and the numbers at the same time.